Fung, and I'm a senior traffic safety. Oops, sorry. My name is Lawrence Fung, and I'm the senior traffic safety specialist at the New York City Health Department. After the first Research on the Road event in 2016, New York City Vision Zero agencies published a research agenda, which described current projects and outlined future research and questions that are most crucial to moving Vision Zero's efforts forward. In this presentation, I'll be providing a high-level summary of accomplishments where we answered many of the questions outlined in the research agenda. After 7 years of Vision Zero, we accomplished a lot to make our streets safer for all New Yorkers, but more work is ahead of us. Vision Zero aims to eliminate all traffic fatalities and severe injuries. Vision Zero task force partners have worked diligently to monitor the burden of traffic-related fatalities and injury outcomes in New York City. The number of road deaths and severe injuries are two important traffic safety indicators. The Vision Zero years have been 7 of the 8 safest in New York City since record keeping began in 1910. Both traffic fatalities and severe injuries have decreased. This graph on the right depicts the total number of New York City traffic fatalities by road user since 2000, showing a general decline. In addition to real-time monitoring of traffic fatalities and injuries, it's also important to understand what crash circumstances are associated with injury hospitalizations so we can better inform policy and program initiatives. Prior to Vision Zero, crash circumstances and hospitalization data existed as 2 separate data systems. In 2016, the Health Department completed a probabilistic data linkage project that matched crash reports to hospitalization records using limited personal identifiers, enhancing our knowledge of crashes and related injury outcomes. Subsequently, in 2017, the Mayor's Office of Data Analytics, also known as MODA, analyzed this linked data to predict which types of crashes would most likely result in severe injuries. The analysis found older New Yorkers involved in a crash are at a higher risk for sustaining the most serious injuries. Pedestrians over the age of 70 are more than twice as likely to sustain serious injuries if hit by a vehicle than the average New Yorker. This finding reaffirms that older adults are more vulnerable on New York City streets and our continued focus to keeping them safe. In addition, MODA calculated a severity ratio, which is the probability of a severe outcome if certain crash attributes were present. The results are highlighted here in this graph. Attributes with green bars are also included in New York City DOT's and New York State DMV's definition of a severe crash. Not surprisingly, top predictors of injury severity include unconsciousness and severe bleeding. The analysis showed that current definitions of injury severity used by New York City DOT for prioritizing street safety redesign are aligned with hospital injury outcomes. Thinking about our most vulnerable road users and equity, the research agenda sought to determine if crashes disproportionately affect individuals in low-income neighborhoods. The Health Department found that between 2012 and 2014, the years just before the start of Vision Zero, very high poverty neighborhoods had a pedestrian fatality rate 3 times as high as low poverty neighborhoods. Since 2014 and the start of Vision Zero, these neighborhoods were aligned with where DOT is implementing safety improvement projects. When you look at the DOT pedestrian action plans, you can see how those neighborhoods match up with these. These findings and other details related to pedestrian fatalities were published in 2017 in the Health Department's Epidata Brief series. We know that bicycling is a healthy, affordable, and environmentally friendly way for New Yorkers to get around the city. Cyclists, like pedestrians, are vulnerable road users, and with ridership continually increasing in New York City, DOT continues to monitor and track bicycle injuries and fatalities. In 2017, DOT released a report titled Safer Cycling, which provided an in-depth analysis of crash circumstances and ridership. This report describes the progress the city has made in improving cyclist safety. The table presented here summarizes the most frequent crash types involving a cyclist fatality. Between 2006 and 2016, more than half of these fatalities involved a cyclist traveling adjacent to a motor vehicle or a right-angle crash with a motor vehicle. More details on these cyclist fatalities and strategies to keeping cyclists safe can be found in the report, which is available on the DOT website or in the Vision Zero library. DOT implements numerous street improvement projects throughout the city by redesigning dangerous corridors and intersections. Here's one example of looking at how effective some of these projects are for improving traffic safety. Once known as the Boulevard of Death, the re-engineering of Queens Boulevard has significantly made it safer. The first row of this table shows that in 3 years after the Queens Boulevard re-engineering project, crashes decreased by 19%. Similarly, the number of crashes with injuries decreased by 17%. Pedestrians benefited the most from these safety improvements. The 3-year average of crashes involving a pedestrian decreased by 55%. DOT projects like these are important to provide safer streets for all New Yorkers. Thinking about the effectiveness of red light cameras in New York City, the red light program has proven to be a valuable tool for deterring red light running and protecting New Yorkers at signalized intersections. This program started well before Vision Zero, nearly 30 years ago in 1994. At the beginning of the program, an average red light camera generated about 30 violations per day. In 2019, the average was down to about 6 daily violations per camera. That may sound a bit counterintuitive, but in actuality, fewer violations should be generated over time if the program is successful. My DOT colleague, Julia Kite-Laidlaw, will discuss the program more in detail in the enforcement session later in the conference if you're interested in learning more about New York City's automated enforcement program. Speeding is a leading cause of crashes that result in serious injuries. The faster a vehicle travels, the longer it takes a driver to react and stop. A difference of 5 miles an hour can make the difference between life and death. A pedestrian who is struck by a car traveling at 30 miles an hour is twice as likely to be killed as a pedestrian who is struck by a vehicle traveling at 25 miles an hour. Like red light cameras, speed cameras have been highly effective in deterring dangerous driving behaviors. Speeding at fixed camera locations has dropped 71.5%, and injuries dropped by 17%. 2/3 of vehicles receiving a speed camera violation in 2019 did not receive another within the calendar year. Large declines in average daily speeding violations are seen in many locations with speed cameras, all indications that the speed camera program has proven effective and efficient in its goal of reducing dangerous speeding and its consequences. Most fatalities involve motor vehicles, which is why driving behaviors are crucial to understand and make safer. Vision Zero aims to improve driving behaviors through public education campaigns, which you may have seen on TV or heard on the radio, through street engineering projects, such as the examples I just shared, through policy measures, such as lowering speed limits and implementing tougher penalties for drivers who fail to yield to pedestrians, and through directly tracking driving behaviors among drivers who we can influence, such as city employees driving city vehicles. On our research agenda, we wanted to see if city drivers adopted safer driving behaviors since the installation of onboard telematics, which is directly monitored by our Department of Citywide Administrative Services, known as DCAS. Looking at the left and middle graphs, data has shown that since fiscal year 2015, the number of citywide collisions and related injuries have both gone down by at least 60%, respectively. In the 2 years of available data, excessive speeding incidents have also shown a general downward trend. My DCAS colleague, Eric Richardson, will provide more details about the program later in today's agenda. DCAS is also represented today by Deputy Commissioner Keith Kerman, who is also our Chief Fleet Officer. Thinking about DCAS's Sideguard project and its effectiveness, interactions between our city truck fleet with pedestrians and bicyclists both have gone down by a high percentage. Truck interactions with pedestrians have decreased by 75% since fiscal year 2018, and similarly, city truck interactions with bicyclists have nearly been cut in half since 2018, down 47%. In 2017, NYPD transitioned from a paper crash reporting system to an electronic reporting system known as FORMS, which stands for Finest Online Record Management System. Moving to FORMS allows for efficiently capturing crash characteristics and streamlines data reporting. DOT and NYPD continue to monitor trends in traffic crashes. And in summary, the Vision Zero Task Force and its data working group has made great progress in answering many of the questions outlined in the research agenda from 2016. The work I presented here is just a small snapshot of the work covered by the research agenda, which is pictured on this slide. This is a credit to the good work that each Vision Zero agency contributes to the task force and the Vision Zero initiative, but the work and research are both further enhanced by interagency collaborations and partnerships with external researchers and academics. We hope that current collaborations continue to strengthen, but also hope new ones are developed with the goal of answering many of the unanswered questions on the research agenda to advance Vision Zero. And that's the purpose of Research on the Road and why we're all here today. Not only are we here to talk about current work we've all been doing, but hopefully the conversations inspire new research, questions, and partnerships to take us through the 8th year of Vision Zero and beyond. Again, much work remains to be done in order to achieve our goal of eliminating traffic fatalities. So I hope everyone finds our conversations today helpful. Thanks for your time.
Thank you so much, Lawrence.